Today's lecture is about applying universal intellectual standards in public health communication. I'm Dr. Donald Reed. Good day, everyone. Today I want to talk about how to apply the 9 universal intellectual standards to your public health communication projects. These standards are essential for making sure that the messages you create, whether a brochure, a public service announcement, or an advocacy email, are not only well written, but are also effective, ethical, and professional. We are going to walk through the standards one by one. The first standard is that of clarity. Clarity is the gateway standard. If your audience doesn't understand you, nothing else matters. In public health, clarity means avoiding jargon or explaining terms that could confuse people. For example, instead of saying cardiac metabolic risk factors, you might say conditions like high blood pressure or diabetes that increase your risk for heart disease. Do you see the difference in understanding and clarity between the two statements? The next standard is that of accuracy. Your facts must be correct. If you say most teens in our community vape every day, but your data shows that only 20% of teens vape, you've lost your credibility. Always check your statistics against reliable sources, like the Center for Disease Control or other peer-reviewed journals. The next standard is that of precision. Precision takes accuracy one step further by being specific. Saying many young people are affected is vague. Saying 23% of high school students in McDowell County report vaping in the past 30 days is precise. Precision helps your audience trust your message. Next is relevance. Every piece of information should connect back to your main point. If you're writing a press release about smoking cessation, don't drift into a discussion about alcohol use unless it directly supports your message. Relevance keeps your communication focused. The next standard is that of depth. Public health problems are complex. A shallow solution, like just say no to drugs, ignores deeper issues like peer pressure, stress, or a lack of resources. Depth means acknowledging and addressing these complexities in your communication strategy. Next is breadth. Breadth requires that you consider multiple perspectives. For instance, if you are creating a brochure on healthy eating, you might think about how the message will resonate across different cultures or socioeconomic groups. Breadth prevents the narrow, one-size-fits-all messaging. The next standard is that of logic. Your arguments or your thoughts should make sense and flow together. If you say vaping is safe, and then you cite evidence of lung damage, your logic falls apart. Logical communication builds trust and ensures your conclusions match your evidence. The next standard is that of significance. Focus on what matters most. If you only have 30 seconds for a public service announcement, you can't cover everything about cancer prevention. You must highlight the most impactful message like, schedule your screening. It could save your life. The last standard is that of fairness. We just, we must be just and unbiased in our communication. This means avoiding stigmatizing language, like labeling people as addicts instead of using terms like people experiencing substance use disorder. Fairness respects the dignity of your audience. All of these standards should be in your public health communication pieces. When you apply these standards, your communication artifacts won't just meet the assignment requirements, they'll model the kind of clear, precise, and ethical communication that public health professionals are expected to produce. So, as you work on your brochures, your public service announcements, your advocacy letters, or your marketing plans, ask yourself, is my message clear, accurate, precise, relevant, deep, broad, logical, significant, and fair? If you can say yes, you're well on your way to creating high quality public health communication.